The 358,000 AstraZeneca vaccines from Denmark are definitely a shot in the arm, but not enough for a country that has fully vaccinated less than 1% of its population. Yvonne Okwara spoke to Barbara Neal, the AstraZeneca country president for the Africa cluster, and started by asking her about the state of supply of the vaccine around the world, particularly in Africa.
The first thing is to say here in Africa, we know that 9 out of 10 vaccines that has been supplied into Africa have been AstraZeneca vaccines. We know that 38 countries so far in Africa have benefited from receiving the AstraZeneca vaccine. At the moment, we also know that the devastating second wave that we've seen in India have created a supply shortage here in Africa because of the exports that is not currently flowing out of India. And what we have seen, though, is in the last couple of weeks through the Japan summit, as well as also the pledges of donations that has come out of the G7 summit, that we now know that from a COVAX perspective, we have 1.8 billion fully funded doses to be distributed to low and middle income countries during the course of 2021 and 2022. So where a couple of weeks ago the situation was looking really dire for Africa, we have now seen this breakthrough in terms of the donations. And I think one such an example is obviously the donations that we have seen that's gone into countries such as Rwanda, Senegal, and also today what we are seeing, the donation from Denmark that is coming into Kenya, 360,000 doses. And with that, we really want to commend the Danish government as well as His Honourable the Minister of Health, the Honourable Minister of Health in Kenya, as well as the head of the COVID-19 vaccine task force here in Kenya, for the phenomenal job that they have done and how they've diligently worked over the last couple of weeks to ensure that this supply is happening into Kenya.
Most recently, we heard of concerns from the regulator in Europe around the Covishield vaccine, which is the one that is available to those of us in Africa and in Asia. For purposes of their vaccination passport, they're not acknowledging Covishield. What do you have to say about that? And what, in your view, are these concerns that they have? Are they anything that those of us receiving the Covishield vaccine should be worried about?
I think the first thing is, if we start with the WHO, we do know that the WHO has been very clear in terms of their approval of the AstraZeneca vaccine. We know that through the way our supply chain is set up, that in Europe and in also for instance, the Serum Institute of India, where we're getting the Covishield vaccine from, is we know that it is exactly the same process and supply chain procedures that are used to produce these vaccines. So there isn't really a difference. What needs to happen now is that the EMA, so the European Medicines Regulator, needs to just add Covishield to their to the spectrum of vaccines that they have. And I know that this is something that we as a company are also working with them on to ensure that the Covishield is registered.
And what about patent sharing for African countries? Are there any plans to do this, to enable African countries specifically start to manufacture the AstraZeneca vaccine? Countries like Rwanda and South Africa have expressed willingness and capability to do so. Are we likely to see this anytime soon, knowing that the COVID-19 pandemic is one that is constantly evolving, and African countries are saying, do the tech transfer. We are ready, willing and capable to manufacture this, as India is doing.
The simple answer to this is in order for us to really manage and get as many vaccines into people's arms at the moment, is speed. So a tech transfer can take several months. And this is why the AstraZeneca decision was made, as I said earlier, is that we have a non-for-profit pricing approach, and we are coupling this by already working with 20 partners globally, where we have done a full technology transfer. And this approach that AstraZeneca is following is really also aligned to what the Director General, one of Africa's own for the World Trade Organization, has described as a third way in terms of how we can approach and tackle the whole COVID challenge, by having an access price, a non-for-profit price, and then working with partners that are able to scale up at speed. Definitely in terms of looking at future pandemics and future ways of how we need to also build infrastructure in Africa for into the future is definitely something that is also on the cards, and we continue to work with the Ministries of Health to discuss.
So there is no plan to share the patent with African countries in the near future?
So we have done a tech transfer with 20 countries, or with 20 supply chain functions that we are working with across the globe. And for us, the obvious partner for Africa was the Serum Institute of India. They are the biggest provider of vaccines globally. And as I said, have been serving the African continent for many decades very successfully.
What assurances can you give as far as efficacy for the Delta variant and others that are to come?
So with regards to the Delta variant, in the UK, Public Health England published real-world evidence only as early as last week. And what was clear from that data is that the AstraZeneca vaccine gives a 92% protection against hospitalization. And what we also know is that there were no deaths of patients that received the AstraZeneca vaccine and then contracted the Delta variant. So I think that gives a lot of comfort to people, especially in the African countries and countries such as Kenya, where we know that the AstraZeneca vaccine sits front and center of the whole vaccination program. At the same time as AstraZeneca, together with the University of Oxford, we are also working on what we call our variant vaccine. So this is in a way version 2 of the AstraZeneca vaccine, where the vaccine has been updated to also combat and to work very effectively against some of the variants, such as the Beta variant and many others. And the data is currently in the preclinical phase, and it looks very promising. And we will very soon, over the next coming months, we will start seeing the clinical trials being rolled out to also look at these other variants.